Recording? Okay. Hi, my name is Michelle Urich. I'm going to be your nurse today. I'm going to be doing a head-to-toe assessment. Is that okay?
Yes, ma'am.
I'm going to be touching you at certain times. Is that all right?
Yes, ma'am.
All right, I'm going to wash my hands. I'm going to provide privacy. Pretend there's a curtain here. So I'm going to assume you have a name tag on or a badge, and I'd ask your name,
Megan Thorne,
and I'd check that here, date of birth.
1:30-6,
So you know where you're at.
the hospital.
All right. Do you know why?
Bellyache.
I'm sorry to hear that. Okay, so we have also you have orientation times 4, time, date, place, and self.
Okay.
Alrighty, so and then let me go ahead and look at your hands. I'm going to look for any kind of swelling. The hands are nice and warm. I'm going to see any kind of skin trigger. Make sure she has good retention. I don't see any kind of bruising. I'm going to look at fingernails. Nice and clean underneath, not ragged or jagged edges. Capillary refill. 1, 2 bilateral equal, 2 is a normal finding. Alrighty. Let me go ahead and get you to go to the bathroom. Is that okay?
Sure.
You have any problems burning, itching,
No, ma'am.
hesitation? Okay, like that. Let me get you a urine sample. I don't have a cup. Had a cup. Okay, the bathroom's right over here. So I'll be putting on gloves as she's walking away. I'm going to be looking at her walk, stance, pace, stride, no tremors. She followed instructions. She brought it back. I have the urine sample. I'm going to look for color quality quantity, about 50 cc's. Amber color would be noted if it was available. Wouldn't smell it, but if there was an odor, I'd also notate that. So I put this away, take off my gloves, provide hand sanitation again, wash my hands. Alrighty, so came back. Let's go ahead and do range of motion. So have you stand up real fast. Alrighty, I'm going to have you lift your shoulders. And do that against resistance. I'm going to have you turn your head that way, and then have your head turn that way. Thank you very much. Up, down. Got range of motion there. Can you circulate your shoulders? Rotate. Okay. I'm going to have you have your arms lift, extend. There you go. And down, and then up and down here. Push down against me. Alrighty, and then up. Thank you very much. And then at your hips, I'm going to have you raise your hips. The other leg. She also has balance. And then extend your leg. And flex.
Oh.
There you go. And then extend. Oops, sorry, didn't mean to kick you. And then flex.
Okay.
Alrighty, can you sit down for a second? We're going to do also just your feet. Abduction is in, adduction. She's got good rotation there. Alrighty, can you stand up again? I'm going to go ahead and do your spine. Do you have any problems with moving? Any kind of soreness, stiffness?
No, ma'am.
Can you lean over without bumping your head
Oh.
and as comfortably as you can? Do you mind if I lift your shirt?
Sure.
Thank you for that. So I'm going to go ahead and looking at the spine, make sure it's midline. I don't see any kind of deviations in scoliosis. I don't see any kind of bruising. I don't see any kind of muscle burning or tension. I'm going to look for sacral edema. Okay, go ahead and sit up. Thank you very much. Alrighty, so I'm also going to do AP diameter at this time. So midline, I'm going to go from navel, midline spine, and should have a 2 to 1. So we got a 1, and I wasn't using her arm, going to that outside midline of the body. 2 to 1 there. Alright, I'm going to do Romberg's at this time. So this is to assess for steady. I'm going to put both hands up front, make sure she doesn't fall. Can you close your eyes for me and just stand there? Looks beautiful. She doesn't have any kind of sway, so that's a negative Romberg test. So I'll push her a little bit, but she does actually return well. Alrighty. I'm going to do a whisper test while she's standing. If you don't mind. I'm going to cover one of your ears, and if you can repeat after me. ABC.
ABC.
And
1, 2, 3.
alright, she was able to hear me behind. Alrighty, let's go ahead and if you don't mind sitting down. Thank you very much. I might wash my hands just because alcohol is so convenient nowadays. Do you mind if I touch your head?
Go ahead.
Alrighty, so I'm just going to look at your hairline and see if I note any kind of soreness or tenderness. Do you have any kind of lumps or bumps, parasites? Hair is nice, clean cut. Appearance is appropriate for her business agent's status, as she is a Galen Dirty Dozen student. Thank you. Alright, if she was a bed-bound patient, I'd probably look at her ears behind there to make sure she didn't have any kind of bed sores forming back there also. That looks good. So I'm going to look at her face, look at the eyebrows, symmetry of the eyes to the nose, top of the ears. Her mouth is in line also. Bright and shiny. Can I get you to smile again? There you go. So that's equal and even. Can I have you puff out your cheeks? There you go. And can you open your mouth? Stick out your tongue. All right, let me go ahead and look at your uvula while we're at it. As you got cheese in your mouth. And can you say ah?
Ah.
And then uvula did go straight up. Do you have any soreness, any sores, teeth sores, anything like that from swallowing? like that. I'm gonna go ahead and do your eyes right now.
Okay.
So this is kind of bright, hard to have the lights dimmed. Can I ask you to look over my shoulder? And I'm gonna pass the light across your eyes twice. First time is I'm gonna look for pupillary, how tight they go down. She went down to 2 equally. I'm also gonna look for reflection, make sure they're in both eyes, equally and in the same location. There was one eye. Let's go ahead and do this other one. Diameter down to 2. One more time. Thank you very much. Now we're going to do a combination. You look at the top of the pen, and I'll go slow so it's not to dizzy you, and just follow it with your eyes. Thank you. That was a combination, so both eyes were reactive and followed. Alrighty. Snellen test. Still didn't grab my name tag. As a professional BSN student, I would have my name tag over my right hand shoulder. I'd use the smallest lettering available at this distance, see if she could repeat the name that she could read.
Michelle?
Okay, if not, I would have a Snellen test, which would be 20 feet in the chart, and ask her to read the smallest label at that time also. Sorry about that. All right, so we've done eyes, done Snellen test, we've done whisper test. Let me go ahead and look in your ears. So on adult, I'm going to pull the painting up and back. I don't see the eardrum, but I see the hairs, and I don't see any kind of drainage. Do you have any soreness, nothing
No, ma'am.
draining at any time? Go ahead and do this other ear on the adult, painting up and back. See the hairs, there's no discharge, I don't see any sebum. Looks good and clean. Let's go ahead and look at your sinuses. I'm gonna look up your nose. She does have a deviated septum. I can see that midline. Look up. Mucosal's pink, moist, and hairs are not obstructive of any kind of debris like that. Let me go ahead and palpate your sinuses at this time. So I'm just gonna touch your head, go above your eyes. You have any pain or pressure there? Anything discomfort? Okay, go underneath. Anything there? Nothing sore? Okay, so I'm going to also do at this time your linguals. Let's see, the eyes, nose, mouth, ears. That's all I know to ask right now. I'll come up with it. So I'm going to look at right here is submental, submandibular. Preauricular is in front of the ear. Behind the ear is going to be postauricular, occipital. Okay, so this is superficial cervical, deep cervical chain, midclavicular. I'm going to go midline here. And then I'm going to do bilateral equal, see if I can find anything posterior scapula and anterior pectoral. Okay, I don't see anything like that. And I ask you about your linguals. Do you have any swelling or lumps or bumps? There's 2
No,
there
ma'am.
on your side. Alrighty. I'll go ahead and wash my hands. Respiratory. So I need to go on the back. Can you turn around pretty please? Thank you. So let me go ahead and look at her back. I don't see any kind of muscles that are accessories, not from the rear. I'm going to do tactile thermitis for her respiratory assessment. I'm going to ask her to say 99.
99.
That's bronchiovesicular.
99.
Bronchiovesicular.
99.
And then one more.
99.
Thank you very much. And go ahead and listen to 8 different points on her back. And I'm going to do bronchophony. Can we say EE? Bronchial. Not over the scapula. And E. And not over any bones. And that's vesicular. Vesicular. Alrighty. Thank you very much. Let me go ahead and do that on the front. Can you turn around for me?
Now you
Thank you, thank you.
have to
I'm
say.
doing tippy-tappy. Alrighty, so I don't see any muscle guarding, or excuse me, any kind of muscle or accessory muscles being used while she's breathing. I don't see any kind of labor, breath sound or breath movement. Go ahead and lay down for me, pretty please. Alrighty. So I'm gonna go ahead and listen. Already looked, already visualized. I'm gonna listen to 8 points also again. So I'm gonna start at bronchial. And have her say bronchophony would be an additional E. Can you repeat E? Thank you. Bronchiovesicular. Again. Bronchiovesicular. And then vesicular. Alright, does this sound progress down lower? It started to become duller, but was equal even on both sides, and as it progressed down. Alrighty, I don't see any accessory muscles. Let's go ahead and do cardiac. So on cardiac assessment, I would do a 1-minute assessment apical, and that's at the S2 sound, which is at the 5th intercostal space. So I'd go the substernal notch, going to the, even with my cheek, remember, substernal notch, not angle of Louis? Yes, angle of Louis. I'm going fishing with Louis. That's how I try to remember. Angle of Louis, second intercostal space. Alrighty. And go to listen to the apical pulse, which is going to be at the fifth intercostal space, mid-clavicular. And I'll listen to that for 1 full minute. Actually, can compare that to her radial pulse, and I would listen for 1 full minute. Sneeze and at the top. Oh wow, they lined up. Alrighty, it was 1 full minute. Alrighty, so now I'm going to go to S2 sound, which is again substernal notch, angle of Louis. S1 or S2 up here is assessing her aortic. I'm going to go to S2 to her left is going to be her pulmonic. Herb's point, go across to the third intercostal space. I'm going to be listening to tricuspid. And fifth intercostal space, mid-clavicular, is going to be her mitral valve. Alrighty, and I'd also sit her up to about 30 to 45 degrees and look for any kind of jugular distension. Thank you for that. And we can go ahead and look at your GI, and her stomach. Do you mind if I move your shirt for a second?
That's fine.
Thank you. So I'm going to look for any kind of sores, any kind of muscle tension. Just as visualizing it, I don't see any kind of distensions. And I'll listen to quadrant 4 for 1 full minute, which is mid navel to lower. Actually, I only have to listen to that till I hear a sound, or for 1 full minute. If I don't hear anything, I'm going to listen to all 5 quadrants for 5 minutes, full entire minutes. You've got an active stomach. I always hear something right on you. Okay, so I heard something there. I'm going to go ahead and out palpate for her. Any kind of gut. I don't see any muscle retention. I don't see any guarding. I don't feel anything. I don't see any kind of bruising. Any sore tenderness?
No, ma'am.
Okay. Don't feel anything. Alrighty. And then on GU, go ahead and sit up. Okay. Wash your hands. Alright, on your monthly cycles, do you mind me asking, are you doing breast exams once a month?
No, ma'am.
Okay. I'd really encourage you to do that at least once a month, every single month. About the 4th to the 5th day of your, 4th to the 7th day of your period, if you have a period that long.
Okay.
And you'd start in the mirror. You actually have to need to look at yourself, have the breast just dangling, look for any kind of stretch or any kind of lines or ligaments, any kind of puckering also, or any kind of out of shape or for yourself. They may be asymmetrical. That's sometimes a difficult finding also.
Okay.
And you'd use actually 2 fingers. You can go to the bath, warm up, relax, go to lay down. Center 2 fingers. And I do it in a circle. Actually, I start at the top and I go all the way around, palpating all the way around,
Okay.
all the way to the nipple. Make sure if you notice any kind of, if you feel anything loose, tight, small, or large, you can notate that to your doctor. Please tell them.
Okay.
And if you have any discharge issues, sometimes that
Oh,
can happen.
okay.
And let's go ahead and do your feet. I'm going to look for edema down here. So we already did abduction and adduction. I'm going to look for feet, the nice and kind of toes are a little bit cold. I'm going to look for edema. I don't see any kind of bruising either. Fingernails, toenails look clean. Warm. Skin trigger looks good. I don't see any kind of edema, so that would be a 0 finding, which would be normal. Capillary refill. 1, 2 bilaterally equal, and I like to end with a Pippin scheme. It should be a sharp null, and her toes will curl that way. That's all I know to ask. Alrighty, let me wash my hands. Do you have any questions for me?
No, ma'am.
Okay, and then your
Thank
doctor
you.
will be right in with you.
I appreciate it.
Thank you.
Have a good day.
Cheers.